Meet Sarah. Sarah is a high school teacher with a PhD in clinical psychology, 2 kids, and a loving husband of 10 years. She is well liked in her community and volunteers at the local food pantry and her church. Sarah is being seen by Dr. Johnson for pain due to tendinitis in her elbow that arose from years of competitive tennis. After a brief exam and a review of her medical record, Dr. Johnson prescribes her 7.5 milligrams of hydrocodone, with instructions to take every 4 hours as needed for pain, and gives her 90 pills. Sarah took her medication as prescribed at first, but soon began misusing and even began using substances not prescribed to her. While Dr. Johnson based his decision to prescribe narcotics on what he did know about Sarah, it's what he didn't know that would eventually cause Sarah to become addicted and unintentionally overdose on a combination of illicit drugs and the medications he prescribed. This decision is also what led to Dr. Johnson losing his medical license and being criminally prosecuted. Now let's rewind and see what might have happened if Dr. Johnson had actively verified Sarah's suitability for opioid therapy prior to prescribing. In this scenario, Sarah was enrolled in the SureMed Compliance Care Continuity Program by Dr. Johnson, and using a computer, tablet, or smartphone, she answered a series of questions aimed at better understanding her individual risk for substance misuse and addiction, and was educated on the risks of opioid therapy. Once she was finished, the results were instantly transmitted to an easy-to-read dashboard that Dr. Johnson could access from any computer, tablet, or smartphone. It seems that based on the Care Continuity Report, Sarah is at a high risk for substance misuse due to factors that she didn't even know were important. Factors like family history of alcohol abuse, depression, and even her overall outlook on life. These factors had the ability to be combined with clinical diagnostic results and reported to Dr. Johnson in real time on the same dashboard, giving him the information he needed to make the best possible decision for Sarah. And most of this happened outside of the doctor's office, allowing Dr. Johnson to see a full load of patients that day. What's more, the Care Continuity Report was added to the patient's chart and referred to in the progress note, fulfilling many of the regulatory guidelines and helping mitigate Dr. Johnson's civil and criminal risk. This was confirmed through a SureMed compliance audit that showed Dr. Johnson what he was doing well and what documentation he was missing. Sarah was given 7 days of the lowest dose opioid for her injury and was instructed to only take when pain was most intense. Sarah's injury, while chronic, was better treated episodically due to her risk level for misuse. And because of this conservative treatment plan, Sarah never became addicted to her medication. For more information on SureMed Compliance Program features such as training, chart auditing, a written diversion control plan, and the first and only active verification tool, the Care Continuity Program, visit SureMedCompliance.com. SureMed Compliance, changing the culture of opioid prescribing.